Hello, this is Martin Thomas from Workers' Liberty, and I'm speaking on Tuesday, the 17th of March. Workers' Liberty is working to make the labour movement an active factor, an essential service in dealing with this epidemic. We're doing this not because we think the labour movement is strong enough to take over society at the moment, or because we think that we, or the labour movement as a whole, has the resources at present of the expertise to second guess the public health experts. We're doing it because we think the labour movement is and must be an expert at least in a couple of things. One is in fighting to override and defeat the entrenched antisocial interests of private profit. The second is with supporting and defending the worst off, the most oppressed, and the most exploited. And those are the things the labour movement has to be an essential service for in this crisis. For example, the government is talking about buying in capacity from industry, buying in capacity from hotels for extra NHS facilities for good money. We campaign for the government to requisition those industries, to requisition those hotels, to requisition the extra facilities the NHS needs in this crisis, as capitalist governments have done before in wartime. For example, in a number of workplaces, we know from the efforts of our own activists who are trade unionists, unions have won full sick pay for those who need to self-isolate, not only for the regularly employed workers, but also for workers on zero-hour contracts, agency workers, and similar. We know in some workplaces, the unions have won agreements on time off, scheduled time off for workers to wash their hands regularly, for proper treatment, proper conditions for the cleaners. We also know that in many workplaces, none of those things have been won yet. It is the labour movement who can win that. It is the labour movement that can push the government into taking the requisitioning measures that it needs to take. And so what we demand, in a word, is an emergency plan for both at the international level, at the national level, at the level of each local authority, at the level of each workplace, and for the workers' organisations, the trade unions, to have full information, to be consulted, to be given a decisive voice on issues of workers' conditions, and to act throughout as a monitoring force and as a force to override the obstructive behaviour of private profit. We demand that universal credit should be paid without delay and in advance, that the level of benefits should be raised to enable people to live during the epidemic, that all rent payments should be suspended, evictions should be suspended so that nobody is thrown out of their home in this crisis, that local authorities be given by central government the resources to house and provide care for the homeless, that workers who have to take time off to look after dependents also get full pay when they take time off, so they can do that if they need to. We're not, especially for closing schools immediately, or maybe not even for closing them entirely at all, because there is a strong case for keeping them at least partially open for the children who depend most on them for free school meals, and for a safe, hygienic place to go. We are not in favour of the labour movement restricting itself just to the defence of those workers who can readily work at home, who have safe, hygienic homes to go and self-isolate in. Good for those people. If you have that facility, it's good to use it, to encourage others to use it. But large parts of the working class are going to be continuing to work through this crisis in essential services, and the labour movement has to be there with them all the way. It's our job also to raise the issues of the very worst of the homeless, of those in detention centres, of those in prisons, of those in refugee camps, to say that they should be moved out of those crowded facilities, that they should be allowed to be resettled in areas where they can get the care they need, where they can live in conditions which will enable them to have the best chance in this epidemic. From that point of view, we're critical of unions which have pretty much shut themselves down during this epidemic. For example, saying that all their meetings now will be online only, or saying they will no longer organise picket lines. We understand the case for avoiding large crowded gatherings. However, small meetings which take place under conditions where those taking part can practice social distancing, where people can be seated a distance apart and so on, those will have to continue, and they should continue for the labour movement too. Picket lines can be organised with that social distancing. There are other forms of activity that trade unions can and should encourage. For example, you have the right, under a law of 1996, to withdraw to a place of safety if you think your conditions at work present a serious and imminent danger to your health. Your fellow workers being forced to come into work, economically forced to come into work, when they are sick with the virus, that is a serious danger to you and to your workmates. If you look at our website, you can find a briefing on how you can use that law to force your employer to make proper provision for those workers who are at present not being offered adequate sick pay when they're off. You have the right to elect a health and safety representative, even if you do not have a recognised union or any union at all in your workplace. That health and safety representative should then be able to contact and draw on the resources of trade unions to make their case to the employer and do the job that a trade union should do in this epidemic. It's also our job not just to be trade unionists, but to be socialists. That means, as I say, championing the interests of the worst off. It means also looking to the future. This epidemic is so disastrous for a couple of reasons. Partly because climate change has been allowed to develop unchecked, and climate change, we know by its ecological disruption, increases the chances of this sort of epidemic outbreak. We can't say that if socialist measures had been followed, we could definitely have avoided it. You can certainly reduce the risk. We know also that a democratic way of running society would reduce the cover-ups, the delays which there have been with this epidemic, particularly in the initial stages in China. We know also that it's the interests of profit which have meant that the NHS and similar health services have generally been run on the basis of the bare minimum of spare capacity and spare reserves, so that it's been a matter of common comment for years now that even an especially big regular seasonal flu epidemic would overwhelm the NHS. It's been known for a long time that an epidemic something like this was likely. And it's been known for a long time that work on vaccines, which was suspended, which no longer got the funding when epidemics like SARS faded, that should have been continued, that health services should have been run on the basis of a permanent reservoir of spare capacity and spare reserves. And that has not been done fundamentally because society is run according to the interests of profit. Society should be run according to the interests of human need. The capitalist governments are having to defer to that to some degree now. No capitalist government is now claiming that the free market is the way to deal with it, that market signals, market mechanisms will sort it out. Market mechanisms can't sort this out. They can't sort out society. Because we have let them sort out society for so long, we are in the disaster we are in now. After this disaster is over, we need to rebuild the movement to change society. The 1891-1892 cholera epidemic in Russia was one of the triggers for the rise of the working class socialist and Marxist movement in Russia. The 1918 Spanish flu epidemic was one of the triggers for the independence movement in India, independence movements in other colonies, and for the rise of the revolutionary socialist movement in Europe. It was one of the factors behind the creation of the world's first ever National Health Service by our comrades, the Bolsheviks, in impoverished and war-ravaged Russia in 1920. Unfortunately, the Bolsheviks were defeated. What was done in other countries was insufficient. When India won its independence, it won its independence under a bourgeois government, governed by the interests of private profit. This time round, we must make sure that the movement for learning the lessons, which will evolve, is a movement which learns the lessons thoroughly and sets its aim as the overthrow of capitalism and the installation of a workers' government and socialism.